Burn is a global public health problem, accounting for an estimated 180,000 deaths annually. It is believed that the majority of these occur in low and middle-income countries, and almost two-thirds occur in the African and Southeastern Asian regions. The rate of child deaths from burns is currently over 7 times higher in low and middle-income countries than in high-income countries. Non-fatal burns are a leading cause of morbidity, including prolonged hospitalization, disfigurement, disability, and often resulting stigma and rejection. According to recent WHO data, females have slightly higher rates of death from burns compared to males. These contrast with the usual injury pattern, where rates of injury for various injury mechanisms tend to be higher in males than females. Children are equally vulnerable to burns. Burn is the 5th most common cause of non-fatal childhood injuries, while a major risk is improper adult supervision. A considerable number of burn injuries in children result from child maltreatment. In this part of the world, National Burn Prevention Week is observed annually in November, that is in Nigeria, and aims to raise awareness about burn prevention, treatment, and care. The week-long campaign seeks to educate the public on measures to prevent burn injuries and provide guidance on prompt and proper treatment for those affected. Thanks for joining us. I am Victoria Clinton, and welcome to Nigeria Today. Now, joining me to discuss, burn prevention and treatment is Dr. Yakubu Ilia. He's a consultant, plastic, aesthetic, and reconstruction surgeon. He's also a member of Nigeria Burn Injury Society. You're welcome to Nigeria Today.
Thanks for having me. Good evening, viewers.
Also with us for the conversation is Dr. Edith Turner Yahweh. She's a chief consultant, plastic and reconstructive surgeon, National Hospital Abuja. She's also a member, Nigerian Burn Injury Society. It's a pleasure to have you in Nigeria Today.
Thank you.
Now, as the saying goes, ladies first. I'll start with you. So why is it so important for us to talk about burns? We even have a week-long activity, to create awareness of this topic.
Yeah, it's very important to talk about burns because of the sequelae, the adverse sequelae, the morbidity and the mortality. It is largely preventable. We believe that it is largely preventable, completely uncalled for. And when it occurs, there is risk of death. At least data shows that in our climb, about 10 to 25% death rate from burns. And then apart from death, the prolonged hospital stay, as you said earlier on, and then the outcome, cosmetic outcome, and then disabilities, prolonged need for physiotherapy, and all that. And then it's time-consuming and money-consuming also. So most times, some of these patients are not able to afford their treatment. So it's actually very necessary to talk about burns.
Now, coming to you, Dr. Ilia, when we talk about burns, generally, of course, she rightly talked about the impact and all of that. What kind of burns are we talking about generally? What are the types of burns we have, and what are they generally?
Generally, there are a variety of causes that agents that cause burns. Commonly is flames, just like this year's theme entails flammables. So open fire, fire from gas explosion, fire from people carrying adulterated fuel on a bike or sometimes in cars, which can ignite because of the heat and then burns the people. Other causes of burns include hot water burns, which is commonly seen in children, and women, just like your statistics shows, because they are more in the kitchen than the male's counterpart. Hot oil also is a cause of burns that can result into that. Other causes include electrical burns, which occurs as a result of faulty electrical appliances, either in the homes, in the workplaces, or even on the road. You may see naked wire. You won't know that it's active until when you touch it, and you'll be electrocuted and come down with burns. Others include lightning during the rainy season. That can also cause burns. Then we also have frictional burns following accident. You know, when your body part is dragged on the tarred road, it can cause frictional burns.
Okay.
Then frostbite, even though it's not common in this part of the world, is also a cause of burns. That's extreme coldness instead of heat this time around. Because of ice, you are exposed to cold weather. We call it frostbite. That can cause burns also.
That's another kind of burn too?
Yes, but it's not common in this part of the world because we are in the tropics.
What of the acid burn?
Acid burns, there's chemical burns, also burns that can either be acidic or basic burns. So it depends on the type of chemical. It can also cause burns. Then another form is inhalational burns, which burns the airways. As you inhale the hot fumes or hot air as the body is being burned, or if it's in an enclosure in the kitchen, in the room, you inhale those, which can result into inhalational burns, burns that burns the airways down into the lungs.
Oh, that is the internal burn?
Yes. So that one is even a more dangerous one than the one we see on the surface of the body. Yes. So those are some of the causes.
Okay, now back to you, Dr. Edith. Now talk to us about the Nigerian scenario, because of earlier on we get the statistics globally. How bad is it in Nigeria when you talk about burns? How bad?
Okay, we have a national registry where centers that are involved in burns care send statistics, even though not all the centers are sending statistics. Okay, but right now, statistically, flame burns is the highest type of burns, okay, generally, and especially involving males. It's high in males, flame burns. Then we have scald burns. It's commoner in children.
What do you call that?
Scald burns.
Scald burns.
So burns from liquids, hot liquids, water, oil, is commoner in children. Okay, of course we have other burns like electrical burns and chemical burns. Electrical burns, we see it sometimes welders or people working with mass and all that, and then they hold the metal object and there's maybe a AEDC cable or something, and then that metal touches and then they get burnt. So there can be a flame component, there can be an electrical component. All right, so generally this is the general what is happening here now, or mainly flame and then mainly scald. And then statistics also shows that from statistics that we have in our registry, it's common in the southwest. Okay, these flame burns are commonest in the southwest. Okay.
Do you have a reason why that should be? Well,
probably maybe they have more. I can't really say, actually. I can't really say the reason. I can't really say. But the statistics now from our registry shows that it's commonest in the southwest, then southeast, south-south, then north central comes about the third or fourth position. All right.
Okay. Now back to Dr. Ilia. Tell us about. I know they have different types of burns, different types of degrees of burns. So talk to us about the degree. Now, I know we have the first degree burn, second degree burn, third degree burn. When can one say, okay, this is the first degree burn or second degree burn?
Okay, burns can be classified into degrees or the thickness of burns. There are two ways you can go. Now, first degree occurs when the most superficial layer of the skin is burnt. And in that case, you may just have severe pains, and then maybe just discoloration, redness over the area because it's not deep. But in that persons, you may not be able to see that.
So how can you handle these degrees of burns? As you're talking about the degree, just tell us how you can handle
so
it.
for that one, what we advocate is you run it under a running water, room temperature, not cold water. You have a tap, you run it over 10 to 15 minutes. That reduces the hotness or the burns that would have occurred, because the depth of burn depends on the contact time and the heat agent. So if the agent is even not very hot, but the contact time is long, it will be deep. Then that one, of course, we usually advocate people to go to a hospital, even if it is a small burn. Don't say you will treat yourself at home. Then the second degree is the one that involve deeper layer of the skin. In this one, you have pain, you may have blisters, that's skin that is raised with fluid inside. And then some areas may have ruptured. You will see deep skin which looks pinkish to red. That's a second degree and is very painful. Then the third, of course, this one also go to the hospital. The first aid usually is to run whatever burns you have under room temperature water for 10 to 15 minutes. Then the third degree is the one that has involved the whole layer of the skin. In this case, you may not even see any blistering again because it's deeper. The pain may not be as much as the one of the second degree, because the sensation that causes pain have been burnt by this fire. Now the color may be whitish, but it won't be pink like the second degree. Then the fourth degree is the one that the burn has gone down to the muscle, to the bone, to the tendons. So this one looks charred, it looks dark or white. And then surprisingly, this one is not painful, because like I said, the nerve endings are completely burned. So the patient may come to you not complaining of pains, even though you can see obvious burns. So in that aspect, you know it's a deep or fourth degree burns. So the treatment, of course, sometimes if it is circumferential, that is going around a limb, you may have to do some of little surgeries we call escharotomy. That is to open up the skin, because the skin becomes charred. It's not pliable again. It's not elastic again. So it can compress that limb. Blood supply to the other part of that limb may be impaired. So you have to cut that skin for it to relax, for blood supply to go down.
Now, let's go to the prevention of this burn. I know it is preventable, like you rightly said. These are things you can avoid. So how do we prevent these kinds of burns in our environment, whether it be it at home, even in the workplaces, like industries, and all of that?
Okay, so for the theme of this year is flammables. So, and flammables include anything that can easily ignite and let's say catch fire, okay? Things like fuel, petrol, things like kerosene, things like liquefied petroleum gas, our normal, let's say our normal cooking gas and all that. So one of the preventive measures is, for instance, for let's say gas, for instance. We will advise that don't put your gas cylinder inside the kitchen. If possible, let it be outside, okay? And then if it develops a fault, please call the technical people, those who they can handle it more professionally, so that you don't go fiddling with the head of the gas and then you have an explosion, okay? So that's one. And then storage of these flammable materials like petrol, it's not, you shouldn't put it in the room. Put it in outside preferably, and then close the container, and then don't go to where these flammables are with things that can easily ignite, let's say naked fire and all that. And then sometime when we used to have this petrol, rampant petrol, people are watching match, generator is on, and then suddenly it finishes. While it is still running, they now go to refill it. It's a dangerous practice, because the generator is already hot, so it can actually ignite, okay? So these are some of the practices. And then let's say for scald now, for it, and then these incidents of carrying jerry cans of petrol in vehicles. When there's an accident, they can easily ignite, okay, and then passengers may be trapped and then get burnt. And then for scald, for instance, at home, another thing to prevent scald, especially for children, is please don't carry hot water to meet cold water. You want to take a bath a child or take a bath, carrying hot water in the house, you know, somebody can easily bump into you and then the water spills, okay? And then keep a burning object, keep hot objects or cooking stove and all that above the reach of children. If possible, kitchen should be out of bounds to children, okay? Or while you are cooking, somebody else can mind the child. And then of course, preferably don't have your stove and cooking things, like let's say gas, you know, at least one cylinder gas inside a room where there's no ventilation and no exit point, okay? We have incidents where there is a fire and then there's no exit. So if you are going to be handling flammable things, okay, or having this kind of thing, then there should be fire extinguisher. For instance, in the workplace, people should be taught how to handle, how to at least be able to put off a fire, okay? And then there should be easy exit, okay? And then of course, other people that professionally handle flammables, they should be properly kitted, okay, to handle such things. I think that's the little I can say for now.
Why you're just saying all this thing, it's just scary because a lot of things we take for granted. A lot of things, like you're talking about carrying jerry cans of fuel inside the vehicle. A lot of our drivers do it these days. You know, they have jerry cans of fuel inside the vehicle. Maybe get somewhere on the road, they tell you, okay, the fuel is finished, they bring it out. They feel. A lot of these things happen. And you're talking about the gas, having the gas inside. What of those, you know, those cylinders that you know, they have burners, and that is what people use in their houses. You know, so what do we do in this kind of case? Because you talked about keeping the cylinders outside the kitchen, if possible, right? And now we have some gas cylinders that have burners on them. So how do we deal with such cases?
Okay, for instance, we have a case, somebody, exactly this scenario. It's now it's not even the gas that exploded or something. But then you are cooking with that and then maybe hot oil in the kitchen, on the floor. A child runs into it. Because the handle, you can't even tell the person to turn it anyhow. If it's like a gas cooker, you can say, okay, turn the handle inwards. But this is now round, just in the kitchen, and the child just bumps into it and then gets burnt. Okay? And then, truly, if you are having that kind of cylinder, I think you should maybe cook on the corridor. Yes, so that if anything happens, at least it's outside, not in the kitchen. Okay, so as much as possible, let your gas cylinder be outside. Okay, and then piped into. But if you are not going to have that kind of, if you don't have that scenario, then maybe cook in the veranda.
That's an eye-opener. So, Dr. Iliana, we've talked about you know, some of the prevention. I don't know if you have other ones that you want to add to what she's already said, but then, in addition to what she said, that if we have an incident of burns, it occurs, we don't pray it does, but if it happens, you know, what kind of, you know, treatment, like as a matter of like first aid treatment, can be administered? And what are some of the mistakes people make that might worsen the case of a victim of a burn?
Yes, thank you. Just to add to that, the prevention, like my chief has said, hot pots, the handles must be well insulated. Because sometimes as you lift the pot from the burner, you can mistakenly, because of the heat, you leave it and it pours on yourself or somebody around. So use something to insulate the handle before you take. Now, in case of burns, if it has happened, we always advise people, like I've said earlier on, the home first aid should just be to run normal water and then get a clean cloth and wrap the patient round and then bring the patient to the hospital. Most of the time, people apply a lot of things. The burn wound ab initio is considered sterile because even if there were germs on one skin, with that heat of burns, they would have been destroyed.
The
Yes. So, but people
that's
apply
the
a
see
lot
what
of
is
things.
what is
yes.
stronger than the than them.
They apply palm oil, raw egg,
Even salt.
water, salt, all manner of things. So these things now contaminate the burnt wound. So before coming to the hospital, we don't advise such. Just bring the patient immediately to the hospital. We'll take it up from there. Now the treatment entails, the first thing is to prevent the kidneys from acute damage. Because once burns occur, a lot of fluid is lost from the body. So with that severe dehydration, the kidney tends to shut down. So there's a way we calculate the fluids that we give in the first 24 hours of burns, depending on your age, your weight, the percentage burnt area, and then we get the number of liters to give. Then we give the patients. And the next thing, of course, they will be in pains. We give painkillers to allay their anxiety because most of them are in pains. We give antibiotics in the part of the world because of the contamination of the burnt wound, like I said. But outside world, they don't give antibiotics because patients usually are aware of what to do. They bring patients directly to the hospital without burn wound being contaminated. So you just treat without antibiotics till when you see telltale signs of burn wound infection, where you can do wound culture, then you now treat with specific antibiotics. Then, of course, we give some other drugs that guard against ulceration of the stomach. The pain can cause what we call gastric erosion. So we give antacids. Because of immobility, we give anticoagulant. That's blood thinners so that there won't be blood clots in the blood vessels that can cause other grievous problems to the patient.
Okay. Now, back to you, Dr. Edith. How affordable is the treatment of burns in Nigeria? Because I know you are a reconstructive surgeon. So that alone, even the name, it sounds very expensive.
That is why I want to emphasize on what he said about the water. It is well known, based on research, that if you place a burns wound in water, either running water or a basin of water, not cold water, just normal room temperature water, for 10 minutes to even up to 20 minutes, and then you now bring the patient to the hospital. It reduces the depth of the burns because it shuts down the burning process. After the initial burns, there's still ongoing burns microscopically. So when you insert inside water for 10 to 20 minutes, it reduces the depth of the burns. So it's not only about pain, it reduces the depth of the burn, therefore reducing the need for surgery, reducing hospital stay, reducing mortality and morbidity. So I'm just saying, at least let's help ourselves by applying water before coming to. So not PAP, not any other thing. But I can tell you that it is not affordable. Most of our patients, we end up going about begging for money to treat them because some of them come late, the bones are already infected, and so they will require surgeries. And sometimes this surgeries is not once, most times twice, 3 times, okay? And then the dressing materials itself. The dressing materials, in fact, I'm not sure it's even covered by NHIS, some of this dressing. So the dressing materials, you know, for them to remain on dressings, you know, sometimes alternate day dressing or sometimes daily dressing. These are even the cheapest dressing material we try to use. If you now go to the expensive ones, that's another matter.
That's another matter. So in other words, prevention is better than cure.
Yes.
Thank you very much. With that, we'll wrap up today's episode of Nigeria Today. We say a very big thank you to Dr. Edith Turner Yahweh. She's a chief consultant, plastic and reconstructive surgeon, National Hospital Abuja, and she's also a member, Nigerian Burn Injury Society. Thank you so much for coming and sharing your thoughts with us.
Thank you.
And also we had Dr. Yakubu Ilia. She's a consultant, plastic, aesthetic and reconstruction surgeon. He's also a member, Nigerian Burn Injury Society. Thank you so much for coming.
Thank you for having me.
And thank you for being part of the program. I am Ikaria Clinton. Goodbye.